and hygiene. Hi, my name is Macy. I'm going to be your student nurse today. Can you tell me your name and date of birth?
Corey Vickery, 4/19/89.
Okay, can I check your wristband? Thank you. Do you have any allergies we need to know about? Or any pain today? Okay, do you need to use the restroom before we get started? Okay, I'm just going to ask you a couple of questions. Do you know where you're at today?
Auburn, Alabama,
And do you know the date?
May 4th, 2020.
And you know who our president is?
Donald Trump.
Okay, good. When she walked in, I would assess her mobility, body structure, behavior, all that's normal. So I'm just going to get started. I'm going to go ahead and check your scalp for any lesions, lumps, parasites. All that's good. And I'm just going to go ahead and check your temperature and temporal pulse. Okay, all that's good. We're going to go ahead and do all your cranial nerves. So cranial nerve 1 is the olfactory. And so I'm just going to get you to close your eyes and smell something for me.
Cleaning white.
Okay. And the second one is your optic nerve. So I'm going to get you to look at something straight ahead. And I'm going to look into your eyes. Okay. And just focus on my pen light. So I'm going to test for accommodation. Alright, good. And the next nerves are 3, 4, and 6, which are the oculomotor, trochlear, and abducens. So I'm just going to get you to focus on my pen light. Just move your eyes only for me. Okay. And now I'm just going to test for consensual light reflex. So again, just focus on something. I'm just going to look in your eye. Okay. Good. So number 5 is next, and that is the trigeminal nerve. And that is going to be to clench your teeth for me. Go ahead and do that. Okay. And number 7 is facial nerves. So go ahead and smile for me. And puff out your cheeks. And raise your eyebrows. Alright, good. So 8's going to be auditory nerve. And so I'm going to get you to cover one side of your ear. And we're going to whisper in the other. And just repeat what you hear me say.
1, 2, 3.
Alright, and do the same with the other ear.
1, 2, 3.
Okay. So 9 is the glossopharyngeal. So I'm just going to get you to swallow for me. Okay, good. And 10 is going to be just open your mouth and say "ah," and I'm going to look. Okay, and I'll be looking for any kind of deviated uvula or anything like that. 11, I'm going to test your spinal accessory. So I'm going to put my hands on your shoulders and push down, and you push, you shrug, and then push to that side, and push your head to this side. Okay, good. And 12 is hypoglossal. So just stick your tongue out for me and move it to each side and say light, tight, dynamite.
Light, tight, dynamite.
Okay, good. So now I'm going to check your lymph nodes. So I'm going to do pre-auricle, post-auricle, occipital, superior, cervical, posterior cervical, and subclavicular. Okay, and while I'm here, I'm going to go ahead and do her carotid arteries. Okay. And so next we have, I'm going to go ahead and listen to her breath sounds. Oh, actually, yes. I'm going to listen to her breath sounds. So first, I'm going to do the bronchial breath sound. So just breathe in and out for me. Okay, and these are high-pitched sounds. Next, I'm going to do the bronchoseculaire. So again, just take a deep breath for me, in and out. Okay, now I'm just going to do posteriorly. So again, just breathe in and out. Okay, and now I'm going to do vesicular. Just again, breathe in and out. Right, good. So next I'm going to do the heart sounds. And I'm going to start at the aortic. Okay, and that's at the second intercostal space. And I'm at the pulmonic. That's also at the second intercostal space. You can hear S2 the best right there. Next is Erb's point. Okay. Then trigeminal. And mitral or apical. And I've listened to the apical for 1 full minute, and then now I'm going to go back with the bell and listen. And Erb's point is right here, and that's at the third intercostal space. Trigeminal is at the fourth intercostal space, and mitral is at the fifth. And also the bronchovesicular breath sounds are medium tone, and the vesicular are a low pitch. So now I'm just going to check your arms out. I'm going to check for skin integrity, edema, anything like that. I'm going to listen to your brachial, or you're going to feel for your brachial and feel for your radial. Okay, now assess for capillary refill and tremors and anything like that. Okay, now go ahead and squeeze my fingers for me to test your strength. And so now I'm actually going to see her skin trigger on her clavicle, and that's good. So now I'm going to just do your abdomen. So if you will, go ahead and lay back for me. Actually, make some of this stuff. So first I would inspect her abdomen. Everything looks good. And next I'm just going to auscultate. I'm going to start in her right lower quadrant. Okay. And listen to each quadrant. Okay, if I did not hear anything, then I would listen for 5 full minutes. And next I'm just going to palpate for tenderness or any bladder distension. Everything's good there. So next I would assess the genitalia. For this, for a female, I would assess for any odor or discharge, and I would look at the hair distribution for male. I'd also look at the hair distribution, and I would make sure that the urethra is medial, and that I would note that the inguinal node is in the groin area, and that the temporal pulse, femoral pulse, is is below the inguinal ligament and between the pubis and anterior superior iliac crest. Okay, and so now I will assess her lower extremities. I would check for skin integrity, edema, again, tremors. I would check her capillary refill, and so I would check her dorsalis medius pulse on her foot, and then the posterior tibial pulse in her foot. And I'm going to get her to push against my hands and then pull. Alright, and you can sit up. And I would leave the patient in bed lowest position, side rolls up times 2, call light within reach, and in a comfortable position. And I would hand hygiene out. Thank you.